The power of a summit like today is that it enables folks to work together and to identify partnerships.
Well-being can take on different definitions. Gallup and our partner Healthways have anchored around the 5 elements of well-being. Have you found a vocation that's appropriate for who you are as a human being? Do you have someone in your life who encourages you to be healthy? Well-being at the highest level is about all the things that matter to a life well lived.
The big problem in terms of the interaction between digital health and nutrition is the fact that we can gain all of this information, right, by monitoring what we're doing. But the real question is, what do we do with it?
We need a new outlook on problem solving. We need a community-driven outlook, and we need some bold ideas to tackle these problems and promote healthy communities.
Healthcare happens when health fails, and we have to catch it as soon as possible, and we happen to believe that real estate can contribute to that. Instead of having easier access to processed food and junk in the air, let's have easier access to good food, walkability, interaction, and enhance the human experience, and perhaps, just perhaps, forget to die a little longer.
It's easy for us to point to healthcare as the factor of loss associated with the change that we would all like to see, but in truth, it takes entire communities to be involved and to help us understand more fully what needs to be done. I don't wish to give the impression that somehow medicine is wrong. I wish instead to express a more basic thought, and that is that no one thing, including medicine, can be all things to all people.
Well-being asks us to quantify how well our life is going. We forget or we don't want to see the topic of disease that very often comes into. Components of one's well-being is feeling the psychological sense of a community that leads to the state of empowerment, that inspires the action, and leads to the change.
It's by educating people about best practices and what they need to do to be healthy, not just physically healthy, but also mentally healthy, and using the digital technology that's out there is the best way to accomplish that.
Why does anybody do anything? Ultimately, you do it because of incentives.
Healthcare is not just what we do clinically, but it's really about the human and social services. And I think that is sort of where we need to go with integrated care management, is providing the holistic picture, because we can't do anything with just a piece of information.
At the end of the day, it's the whole person, and it's leveraging these technologies to scale so that we can serve more people in a way that's really meaningful to them as an individual person.
The bigger point here for the future of healthcare is that we will reimagine the care delivery system around the patient, not the enterprise. Changing the payment model, rewarding new medicine, accessing information that's been recently made publicly available, and stitching together a patient-centered health record. That virtuous cycle is going to bring us the future that we all want.
The technology is really the key today that helps people at an individual level have tools to help themselves while also contributing to their own well-being and taking greater personal accountability for that.